Stop the insanity! Remember Susan Powder from the 90s? But I gotta tell you, sometimes I get cases and all I wanna do is scream, stop the insanity.
Stop the insanity!
Let's take a look at this. The reason I picked this is because this young lady is in the other room getting a cleaning. Take a look at this. Back in 2018, one of my friends, who's a periodontist, sends me this young lady. You are looking at the 22-year-old woman who has no cavities and no problems. She had one tooth that was missing right here in the front. And a dentist went and placed an implant right here. We can discuss the virtues of placing a single implant for a tiny little tooth here at a later date, because it's not always the proper treatment. But take a look at what happens here. All of this dark area that you see is basically an infection around the implant, and it's beginning to affect the other tooth and this one as well. The reason my periodontist friend sent the patient to me is because she was doing some periosurgery here on this, trying to stabilize the gum tissue and the teeth. You can see the sutures here. When I look on the inside, I see a bar, which I'm sure some of you have, that is connecting all the teeth and the implant, and there's the sutures on the tongue side trying to hold this in place. And this is what it looks like when I take that perio packing off. The tissue is red, angry, and we're losing gum on these teeth, and this implant is not doing great. So what do? First of all, you ask the patient to smile. Let's evaluate this for a second. Well, she has beautiful teeth on top and on the bottom, but you don't really see what's going on here. That's great. What I did was the following. I immediately made her a provisional, a temporary tooth to wear that is nice, that will allow me to clean the gum tissue. We cleaned all the accretions on the other teeth, and I told her to brush her teeth gently. We cleaned out the back of the teeth. As you can see, we removed that wire because teeth are not supposed to be held together. They do have some innate mobility because of the periodontal ligament, and I wanted them to resume their function correctly. In a couple of weeks, this is what it looked like. It's healing. We still had some issues with oral hygiene in the area because she was afraid to brush. But take a look at the gum right here. Look how nicely this is healing and maturing. This can be removed with a brush fairly easily. Once we were happy with the progress, I went ahead and made her the final implant crown. Here it is right here. We made it a little bit rounder here just so it supports the tissue and allows us to regenerate the papilla as much as possible. But look how much better this looks. This is a couple of weeks after we delivered the final crown. Take a look. Well, you might say, what about the metal here? Well, this is her smile. What about the metal? She's really happy because guess what? The teeth adjacent to the implant stabilized. Take a look at what the bone looked like last year. Look at this. It regenerated around these teeth and it stabilized around the implant. I did nothing. No surgery. Just stop the insanity. Let the body recover. This was just taken today. Take a look how gorgeous. The bone is right there. Good enough for me. Tooth is stable. Bone is right there. Again, excellent. And look at where the bone is on the implant. Great. Now, we can discuss the merits of this particular implant. We can discuss whether you need to place one here. As I said, I probably wouldn't have placed an implant here. There's better solutions, but it is what it is. Sometimes I can't control what I am presented with. But doing nothing surgically was the right thing to do. Sometimes the human body takes care of it all on its own. Just took this picture right now. Take a look. This is 7 years and counting. And as usual, the smile says it all. So, what's the lesson? Well, sometimes you need to know when to quit, as in doing multiple surgeries over and over again. All you are doing is compromising the blood supply and not letting the body heal. So now you know. From Prosthodontics and Implant Surgery of Manhattan, where people come in with missing teeth and leave with winning smiles, I am Dr. Zev Kaufman. Stop the insanity!